guest speaker for this evening, Stacy Crouther. She's the Business Acceleration Lead for Midwest Advocate Health. She is leading and developing a best-in-class business acceleration program at Advocate Health for the Midwest region. She seeks to identify vendor opportunities and promote collaborative economic wellness. She has a Bachelor's of Science in Mechanical Engineering from the University of Wisconsin-Milwaukee and a Master's in Public Health degree in Public Health Policy and Programs from the University of South Florida. So if you give your undivided attention and welcome Ms. Stacy Crouther.
Thank you so much. Do you know if I'm permitted to share my screen?
Yes.
Okay. Are you all able to see my screen?
Yes.
Awesome. Thank you so much, Dr. Greenware, for giving me the opportunity to share with your students, future leaders, educators. I appreciate your time and the platform to just share some insight from my background and the experience I've garnered in my career thus far. This conversation is really about a career journey, and it's taken a few turns in my life, but I have heard this quote many times, and it says that the journey of 1,000 miles begins with one step. I am a first-generation college graduate, first one to graduate from college in my family. And so when I began to pursue the College of Engineering and Applied Science, my mother was not really able to give me the support that I needed.
Recording in progress.
But I had developed skills from high school and being involved in different programs. And at that point, we had an understanding like, Mom, this is what I want to do. And she signed the papers and, there I went. So it definitely was a journey. And I made up my mind in a very young age that I wanted to be an engineer. I didn't know what type of engineer, but I knew I just needed to take some steps to kind of understand what it was all about. And I needed to find a career that would support the way I wanted to live. And so that's why, even though it was difficult, and I was in many cases the only, I was able to come out and be successful. So then you might be saying to yourself, well, how did you end up in healthcare if you have an engineering degree? Very good thought. So as my introduction has shared with you, I do have a Bachelor of Science in Mechanical Engineering from the University of Wisconsin-Milwaukee. I am also a certified educator for K through 21 age students. I am also a certified auditor, ISO 9000, and also for the aerospace industry. And I've also acquired my master in public health, as you all have heard, with a concentration in public health policy programs and practice. I am certified. I have earned my certification in public health, and I have some icons to just show you some of the turns of my journey. When I graduated from college, my first job was working with an aerospace company, which I absolutely loved. I worked for Honeywell Aerospace in Phoenix, Arizona, and my division was focused on military helicopter auxiliary power units. And it was very interesting. It opened my eyes to a wealth of opportunities I had. From there, unfortunately, I had a great opportunity. I moved back home because I was going to get married, but 9/11 happened. And so in that transition, there were companies that did not do a lot of hiring. So I needed to pivot because bills are real. And I had an opportunity to go into teaching. I was a high school educator for several years, but my passion was in the field of engineering. Um, so I taught for a few years, and then from my involvement and engagement in the community, um, when you know how to do something well, word gets around. So I had an opportunity in the manufacturing environment, and I was able to obtain my Six Sigma green belt and get exposed to process improvements, continuous improvements, data analysis. That's where I obtained the certification in ISO 9000, 9001. Um, and just understood what it meant to become efficient, what it meant to um, apply the engineering and education experience I had. As a new graduate, I did not have experience leading others, managing others. But when you have a classroom, multiple classrooms of 30 students, and I pride myself, I had excellent classroom management skills. Those things kicked in, not that I was managing teenagers or children, but it was the process of understanding what do people need to be successful in executing their task to make the greater project excellent. So I was able to garner skills from my past and implement that in the area of manufacturing. And from my involvement in the community, some of the programs, um, give backs that I had um, led and created, and from their success, word got around in the healthcare space. And truly, at that time, though I was in manufacturing, I was looking for a different arena to utilize the skill set that I had perfected. The great efficient habits I had developed. I just wanted to use it in a different industry. And I was concerned because I didn't want to start over. And I was very excited about those engineering skills that I had obtained and implemented. And lo and behold, I had an opportunity in healthcare. I started off with the information technology department, and then I maneuvered over to working with community health, as well as at the time it was called business diversity. And that allowed me to have a combination of sort of like engineering healthcare, coming from a manufacturing background to healthcare. In manufacturing, changes are made quickly, data is readily available. I'm able to make informed decisions. I know how to get the data, I know how to set up the tests, I know how the equipment runs, I know how to fix the equipment, I know how to set up um, you know, a, a gimbal walk, to kind of understand what is happening, at a bird's eye view. Um, but when I came over to healthcare, I was shocked that while we are doing leading surgeries on the hearts and the brain and the body, that their systems were pretty antiquated. So I had an opportunity. I was just what they were looking for, absolutely what they needed to help implement some efficiencies and streamline some processes. And that has grown and evolved today. I'm not quite sure if you want the students to ask their questions at the end or during the presentation. What has been the flow?
I leave that really up to you. What's comfortable for you?
Well, at this point, If there are any questions, I can entertain it. Otherwise, I can move forward. Are there any questions? I'm sorry, I can't really see you all individually because the screen on my side is kind of small. But are there any questions?
I don't see any in chat. And so if anyone has any questions, unmute yourself and ask. I guess they don't have any at this time.
Okay, then we can keep going. So I just wanted to place this here because as you all are um, learning and developing and understanding the opportunities you have and the opportunities where you're excelling at, um, some of the things that you may not like to do may present themselves as your first opportunity. As an engineer, there was one class that I absolutely hated. I was ready to make a sign and protest. Um, I didn't feel it was necessary at all, and that was chemistry. Um, but I needed chemistry in the aerospace division, and I also needed chemistry in my manufacturing experience. So it's good that you all are getting an variety of exposure, um, as it relates to public health and leading in the public health space. But I just wanted to just plant the seed to let you know that that thing that you wanted to hurry up and get over with and done with, it may be the very thing that presents itself in your first opportunity. So when you have time off, maybe dig into it just a little bit more. What is supplier diversity? Um, Supply diversity is a strategy. It's a strategy that incorporates or takes into consideration a number of things that are impacting the organization. Opportunities, the more variety we have, the more agile we can be as an organization. Supplier diversity requires you to work both internally and externally, meaning you have your internal stakeholders that you work with, and then also you have your community-based stakeholders that you work with. So it's a dual-facing department. Health equity. Health equity is really removing barriers to try to create an opportunity for everyone to receive the best care so that they can achieve the best level of health. And we realize that there are some services that are more readily accessible to some in some communities than others. So, health equity is not a one size fit all. Health equity is having the right response for the right challenge in the right place for the right community. I am under 5 feet tall, so if I wanted to take a group picture, behind, a 6 foot fence, even though I'm shoulder to shoulder with others that may be 6 feet and higher, I don't think that I would have the best experience. So health equity comes into play in all facets of healthcare. Um, when you look at facilitating sustainability, um, what are those measures? Like when we build new hospitals, um, do we have the right entrance on the right side of the street that makes it safe for everyone to enter? Do we have enough parking spaces? Is it accessible in inclement weather? Supplier diversity is really pulling in and identifying businesses or processes or programs that would help meet the need of the organization. So it requires us to build lots of relationships in lots of places and really have a bird's eye view as to what's working and what's not working so that I can create programs, partnerships, and platforms to kind of remove barriers in that area. So supply diversity today, 2025, is a tricky word. And you more than likely won't hear it or see it in very many places. And it's based on current administration. It has negative connotation to some, but in its essence, we now use, instead of supplier diversity, we were already using business diversity. Supplier diversity also is a baseline level program. That baseline level program is really the foundation of us understanding where we're winning and where we're not. So as we start on the yellow box, supplier diversity is really, how much are we spending here? How much are we spending with these types of businesses? And then while I am very comfortable with data and data analytics, we have a team that I work with. Data does not intimidate me. Math does not intimidate me. It is very necessary to make informed decisions. So a supplier diversity program in its infancy is simply counting dollars. How much did we spend with this group? How much did we spend in this category? How much are we not spending? Where are there opportunities? But when we evolve from supplier diversity to business acceleration, which is what we are right now, there are other elements that make our program and our department a little more mature than others. Is nothing wrong with just having the fundamentals of counting dollars, but to have a world-class program, you're going to need some of those other implementations, to kind of catapult you up to innovation and acceleration. The technology. Have any of you heard of Epic or Epic system?
Yes, they have.
Okay, so Epic is a popular system that's used in the healthcare space, and it does a lot of data management of our patients. But we also have other systems like Workday, Core Connect. So those systems aren't the same. So Workday is managing the operations of the organizations, whereas Epic is managing the people that are housed within the health system and their challenges. And if they need, wraparound care, if they're insecurities and deserts, and Epic has the ability to pull that type of data as it relates to the person, whereas Workday is a little bit broader, and it looks at our processes and how we spend, who we're spending with, what is the frequency in which we need to spend. It gives us information on, I don't know if you all may have been aware, but there was a shortage of IV bags. Did you all hear about that?
No.
Yeah, so across the United States, there some of the many of the health systems had single sourcing, and that means that I'm going to get the majority of my IV bags from this one top leading organization. Unfortunately, that organization um, experienced a natural disaster. So everyone, every health system in the United States experienced a shortage of IV bags. They rationed IV bags. They switched protocols for those IV bags. Um, and it really was not that I don't have IV bags for tomorrow, but when you have a system that has planning, it's letting you know in 3 months and 6 months you will have, X number of IV bags that will not meet the needs as you're currently using them. So it was a very big deal in the healthcare industry. That was one of the fewer times where, even at a conference, we were away at a conference. Many of the executive leaders from the different health systems from the conference stepped away to have emergency meetings with their supply chain, and they were trying to identify other organizations that could provide IV bags. So if you don't know about it, in your spare time, go quick and look up the shortage of IV bags. But there were some small vendors that were able to come through for the health systems. And what it really identified is that for that particular category, for that particular item, our supply chain resiliency was not where it should be. So instead of having something so critical being single source, we need to identify what are other vendors that can provide this to us. So we go to conferences and we meet with different businesses. So we have an idea. We're members of different organizations like the National Supplier of Minority Development Council and the We Bank for women-owned businesses and veterans. We're members of these organizations so that we can understand who can fill our need. And so we were able to find and share resources with other hospital systems so we can get a backup of those IV bags. So part of business diversity and supply diversity is identifying those things ahead of time. In the manufacturing world, those would be called the Class A products. And those are products that means if I don't have this component, then this line cannot run. In the healthcare system, it's the same thing. So for those of you that are out there that have an eye for networking or a heart for networking with other people and learning and hearing about different businesses, there's an opportunity as well for you. We also need strategy. Strategy is it needs to be you need to be able to see the big picture and identify opportunities, where the risks are, where the gaps are, and be able to articulate and put a data-driven plan together to share with others. Leadership. Your leadership is not just doing what you're told, but is being able to hear a problem or see an opportunity and being able to articulate it. We use S bars in the healthcare system, and that's where you give a short version of a critical problem. And at the end, that R represents a recommendation. So you want to always have a recommendation that you can give that is applicable and on point to what they are utilizing that task for. Partnerships. I work with a number of different areas in our organization. We have over 160,000 employees. We are in Wisconsin, Illinois, North Carolina, South Carolina, a little bit in Alabama, and we're in Georgia. So there is, and we're still growing. So there are a number of opportunities and people that are trying to move the health system forward. There are a lot of us. So being able to manage relationships and connect and find common goals with other departments are important regardless of what area or what your job title is, if you have the opportunity. I work on an enterprise level, so that means that I work with leaders that have responsibility not just for one state, but for maybe an entire region or the entire enterprise. And then we get into innovation and acceleration. Innovation is, for example, there was a young lady that created a mouthpiece for people that have seizures. Now, I've been blessed that I have not had seizures before, but this young lady devised it because of her family member. And when you feel that you're going to have a seizure, it's a device that's FDA approved that you can put in your mouth to prevent injury. Today, there is no other element on the market. This young lady, I believe she's in her early 20s, and she started working on this as she was going through her master's program in college. So those types of innovative ideas that interest you, that just pique your curiosity, there's opportunity in that area as well. As we accelerate businesses or accelerate opportunities, we want to bring forward um, innovative opportunities that will make healthcare better. For let me see if it's going to the next. Okay, so only 20% of your care comes from within the 4 hospital walls. The rest of your care comes from outside of the walls. So even though you all are focused on public health and um, healthcare administration, there are a number of areas in which you can lead. You have community health, you have community engagement, you have an 80% of a person's care comes from not being a doctor or a nurse. So, for those of you that are wanting to lead in healthcare administration, it's important for you to understand the breadth of the organism you are looking to be a part of. One of the differences in this, I didn't value it at the time, but working with Honeywell, which is such a large company, to get from one building to the next, you actually have to take a golf cart to do it because they're so spread out. But it helped me to understand the vastness of the departments that are all working together to move that organization or that ecosystem forward. So as you're looking at different areas to be leaders in, it's important for you to understand what those other counterparts are. Because, like I said, besides being a doctor or a nurse, 80% of a person's care comes from those areas. If it's in sustainability, leading and understanding what those things are, if it's in planning, design, and construction, you can lead in that space. If you like to understand how buildings are come up, if you like identifying new places to build, new sites to buy or purchase or lease, there's still an element of administration and leadership that's required when you're looking in these other areas of healthcare. And as I'm working to understand how I can partner with the other areas within the organization, these are all some of the areas that I partner with. What's not on here is community health is not on here. Our hospital presidents is listed as our market or our hospital leaders, but community health is important to me. It ties in with common goals. And as a healthcare administrator, it is important for you to become comfortable. It's important for you to become comfortable identifying common goals. Right now, our organization is going through a shift because there are certain interests and emphasis that are made that are being executed right now that requires us to look at how we are executing our programs, how we are partnering with others. And at the end of the day, we are here to um, contribute to the community that we serve and help them to live well. So healthcare administration can be in support services. That means supply chain. That is, what are the goods that we need, and how do we get those goods where they need to be when they need to be there? Professional services. Those have to do with landscaping. If you want to with snow removal. If you want to offer training, if you have um, other business ventures that may be beneficial, professional services, those are those types of umbrellas. We have planning, design, and construction. That is the redesigning, erecting, or removal of a facility. We also have facilities planning, which is remodeling. Sometimes when you've gone to the doctor, you might say to yourself, this room is kind of small. That's probably because perhaps it may have used to be a closet and now it's a check-in room. So they can make those types of changes with facilities. What is the upkeep and care of the building and the floors and the trash? And, there's a difference between cleaning and sanitation. How do we do that? Who do we partner with to do that? Information technology. These are all different areas within healthcare that you all might have an opportunity to lead in. Our legal team, they mostly focus on students that have a law background, but they are there. Human resources. There's lots of different areas in human resources. They focus if you have an under interest in communications, finance, in the business area, our marketing teams. All of these are areas that are leading. And even as our market leader, you have your hospital presidents and you have your administrator, your chief administrators for every department. You can have an administrator for just for patient registration. You can have it for operations. You can have it for outpatient care. You can have it for inpatient care for each hospital. So that's a lot of opportunities as you navigate in the healthcare space. Now, mind you, every healthcare system is not the same, and they're not the same size. But understanding from a community health perspective, what does the community health needs assessment say? Do you know how to read it? Because if you know how to read it and you understand where those pain points are, where those opportunities are, then you have the opportunity to pull together a data-driven proposal and some of the best practices that are tried and true that you might offer as a recommendation. So these are just a number of areas that you might be interested in looking at. And this is, I just, again, I'm an engineer. I love how things work. And this is an arena. This arena is in South Africa. It's a soccer stadium, but it's used for other things. And the way they assembled the arena, it's to be a beacon for the community. And I chose to kind of conclude my presentation with this arena because wherever you go, I think it's important that one, you lead yourself well first. Two, you understand what you are a part of. The organization extends beyond your immediate leader. And it's of value for you to understand what those different corridors and departments are and who's leading them. It's important for you to understand how to present data-driven information. If you don't do that very well, then work on it. It's okay, but work on it. Understanding which charts, which graphs can be concise and help you to understand or convey a message in a very articulate fashion. Understand how to use those tools. Build up the tools in your toolbox so that when it's your time to step forward or participate on a committee or be in a meeting, you have your notes and you understand, oh, this is what I took away from it. So it's easy for you to become complacent when you get a job and you're just comfortable. But there are many changes that happen in healthcare. And so you should be ever learning and understanding your ever changing environment. I believe that every one of you have exactly what it takes to move you to the next step. And as I started out with a quote, to walk all those miles, it starts with one step. So I applaud you and congratulate you for coming this far. And I'm not saying that it's been easy. There are other types of challenges that you would face. But if you made it here today, then you've got what it takes. That doesn't mean you don't have things to work on, but you definitely have what it takes. So that is the conclusion of what I had to share. And I'm open for any questions that anyone or feedback that anyone might have.
This is Rabia. I have a question. If you could go back to your flow chart, the org chart that you have.
Mhm.
Um, when I
This one?
work, yes.
Mhm.
Now, this is, over a decade ago when I was at Henry Ford Health System, and I
Okay.
worked with supplier diversity. And at
Yes.
that time, um, I used to have to report how much of my budget was my spend, and I happened to be community at the time,
Yes.
right? And so they wanted to know how much of my spend of my budget was in with different types of vendors or groups. Do you guys
Yes.
still collect that kind of data, or
So, so the public answer is yes, we are committed to track that data,
okay,
whereas we are limited on the data that we are reporting on.
okay, I understand. I understand.
So yes, there are things that we have to track. Anybody that has a business needs to know these things.
Right.
But when you project it, and that's what I meant with when I was saying, understand what you're looking at, what the data means. If we have our spend and we are a 15, for example, $1 billion organization, and 2% of it goes to um, small businesses, that's an opportunity. You will be provided with opportunities when you have the skill set to be able to identify those things. If you always have to be told every single step what comes next, that does not read as a leader. A
Right.
leader has to be strategic and proactive. So yes, we have to look at the data and understand what is the data saying so that we can make a data informed recommendation. Like we would start a program based on that data. We might not show the data, but we may start a program because of that data that you're describing.
So based on, I get that you may collect the data, but you may not report it because of our current environment, right?
Yes, internally, we're going to look at it though.
Right. And so internally, do you have, and I know quota is a bad word, but for lack of any other word, do you
Yes.
have quotas of what is the percent spend on women businesses, on minority businesses, on, whatever the different groups are? Do you have,
So there is a best practice
okay,
for the healthcare industry, actually for all industries, and that best practice is 10%. Not 10% with women or 10% with minority. It's 10% of diverse spend. That is a legacy known best practice. And there are organizations that have set these metrics. Like for example, there used to be the $1 billion roundtable. In order for you to achieve or be inducted in that, you had to have a certain level of spend within the community with small and diverse businesses. So it's not something that Advocate Health has said, but if you're looking to be on par with where the best practice mark is, it's 10%. Now,
okay,
that 10% may not help you achieve $1 billion. For some organizations, it does because they have spend like that. But for you to just have some type of target, 10%.
And okay, my last question. So when you mention spend with community businesses, does any of that reported up to the work that needs to be done regarding community benefit?
So community benefit, depending on the organization, could come through as donations, grants, but that's in partnership with what you are putting out.
Correct.
But I'm talking about what the organization is putting out, what the organization is spending.
Okay.
So it's not necessarily linked with a community benefit. It's
Okay.
linked with your total spend of your organization. So
Okay.
all of the spending, billions and billions of dollars are spent in healthcare, and all of those different categories in supply chain. Like you might have some supply chain leaders here, that manage categories for paper, for water, for band-aids, for, tubing, for cleaner, for, everything for painting the walls, for cutting the grass, removing the snow. All of those things are different categories. And we try to identify businesses that can fulfill the need with quality and the breadth of the work that we're looking for. And as we spend dollars with them, as they're certified diverse businesses, we can identify them and it adds up.
Okay. Thank you. I don't see any questions in chat, but if there's anyone in the Zoom audience or in
And
the
no question is off the table.
or in the classroom, if you have any questions, now's the time. So in Zoom, if you want to unmute your mic and ask your question, now's the time, and in the classroom, now's the time. Well, we have Ms. Bartley in the class and Ms. Ayana, but Ms. Bartley, what's your question?
My question was, it seems like you have a very diverse background, with your engineering and then healthcare. Within your current position, have you been able to utilize like all of your knowledge, or has it been specified, or have you like honed down onto one thing?
So, very good question. Thank you for asking. Um, I have a skill set that is not in abundance. So, I know what the continuous improvement process looks like. I know how to streamline and develop a program. So, when I do that, in partnering with others, it shows itself, and then you're asked to do more. So, I use a lot of the fundamental engineering skills in my role. Um, because I am developing programs. Um, I know I have to understand about the cost perspective, the delivery, um, the impact, um, and then be able to, at the end, look at it and see how to be better. So I don't know. I see, and I don't mean this in a bad way, but for some of my counterparts that have only been in one area and done one thing, I do feel like there's an opportunity to branch out and innovate how things are done. And I bring that to the table. And it's because it was mandatory as an engineer. I I like to ask questions, and that intimidates some people. I like to understand how things work and what is the process. And some folks don't like that. But I believe if you're going to be a next level leader, those are things you have to become comfortable with. What does your data tell you? Because nobody should argue with the data and then you take the focus off of you. So these skills that I'm pulling out of my toolbox, I didn't think teaching would really amount to nothing. I really at the time thought this is really a waste of my time to contribute to my Social Security right now, right? So but the classroom management, being able to do things at once, moving things forward, keeping everybody together, understanding how to work with different types of learners, understanding what is it that I need to do to remove barriers to get through the resistance. Like that really taught me that. And it came forward. And from that job, I was leading 36 people in my next role. I don't think that would have happened just coming from Honeywell going to the manufacturing facility. And leading people is not an easy task. It takes a lot out of you. But that's what you all are signing up for. You're signing up to be leaders. But to be a good leader, you're going to lead yourself well first. And that starts with understanding what tools are in your toolbox and which ones need to be sharpened up a little bit. Did you have another question, someone?
I keep putting things on mute. We have another student, Miss Ayala, that has a question, and then a faculty person has a question in chat.
Absolutely.
Miss Ayala?
So my question was a little similar to Olivia's. What was that transition like for you after getting your MPH and then immediately starting to work?
So I got my MPH while I was working, and I really was a little intimidated. I really was, because I'm like, okay, um, I know this. What am I supposed to do with it? I don't really use it like that in my department. So I needed for and don't let your growth take a back seat when you land a job. I needed to create a bridge between my current department and community health. And when I did that, when I was able to identify a link or a bridge, that really opened more opportunities for me. I didn't know how at first, but then in working with community health, we did a lot with understanding what community health needs assessments are all about. And those community health needs assessments identify some of the most dire areas and zip codes that need our attention. And so if I know that, then I'm going to look for businesses based on those zip codes. I'm going to understand what types of services are or are not flowing in that department. So there's no cookie cutter that says, hey, I have my master in public health. Now I'm actually certified in public health. And there were some other people that I really, to be quite honest, I obtained my master in public health because I experienced gatekeeping. I'm a sharer. If I have something that can help somebody, I'm going to share it. But that wasn't my experience. So my solution was, I'm going to go and get this myself. And then once I got it myself, I saw ways to use it that it wasn't being used. Who said we couldn't partner and have internal stakeholders? So you don't use the whole playbook of public health in one shot, but there are elements that should stand out to you and docs that you should be able to connect because you've had courses that are, in 2025 that have helped you to see some of these links that are really right now. You probably use a few test cases, in your classes, but these are real communities that, that exist. And to be able to connect those dots, being able to utilize what's in your toolbox is going to open doors for you. It's not going to be you opening doors for yourself. Just showing up and doing the work. I know what I know. I'm a learner. Is this what you see? Am I off target in looking at this way? Those types of opportunities. Wow, you're going to soar.
Thank you.
You're welcome and good luck.
So Dr. Woodley asks, have you had any exposure to the enhanced premium tax credits that help individuals afford health insurance coverage? And how is it affecting your organization?
So I personally have not had experience with that, but right now our organization is moving to a new model. And in that new model, it's taking things like that into consideration. So I don't know what all the outputs are going to be. I have worked in a siloed environment and I've worked in a non-siloed environment. And I believe that those types of changes and changes to how services are paid out, there's a change going on, with that as well. They're going to dictate to us what programs we can keep and what programs we'll have to create or implement. So not just yet, but I'm keeping my eyes and my ears open. But the most impactful thing today would be some of the new executive orders.
Any other questions? Oh, wait a minute, there might be one more. Wait a minute, let me see. Oh, no, just thank you so much. Okay.
Okay.
Doesn't look like there are any. So at this time, I want to thank you for giving of your time and talent to our students and enjoy the rest of your evening.
Thank you very much. I appreciate the time and hopefully our paths will cross again.
Okay, thank you. Bye.
Bye.